My name is Joanna, and I am the CEO of Triage Cancer, which is a national nonprofit organization that provides information on all types of cancer survivorship issues. But my personal area of expertise is as a cancer rights attorney. So I've spent the last 2+ decades teaching people how to navigate all the legal, financial, and practical issues that come up after a cancer diagnosis, including insurance and employment and disability benefits and estate planning. And all of those things have an impact on finances. And so they asked me to speak today about some of the more nitty-gritty details around finances that sometimes are kind of glossed over. And so I'm certainly here for you to be as useful to you as possible, and I do want to make sure to leave time to take your questions at the end. But I did want to give you just some overview of our organization and additional resources, and I'll point to more places where you can go for more information on all the things that I'm going to talk about today. So this is really just an introduction to these topics with pointing towards more information. I do also want to say there are materials in the back for those of you who are just coming in, and if you'd like a copy of the slides, just make sure to sign in on that sign-in sheet, and then I'll make sure to email you the slides today. So Triage Cancer provides information on cancer survivorship issues through hosting of educational events around the country, as well as partnering with other organizations to provide education. We also have a free cancer survivorship webinar series. We do a lot of those webinars on topics related to finances because we know it's so important. And so we also archive those webinars. So you can go to our site and actually see past webinars on a variety of financial topics. And then on our website, we have resources that are specific to states. So call out some states that are in the room. California, Texas, Washington, Pennsylvania. Oh, we've got great representation. I love it. So sometimes some of the resources that are available to you are really based on where you live. And so we have a state-based resource listing on our website, but we also have a chart of state laws. So sometimes the employment protections and the disability benefits and the leave options and the financial assistance and the health insurance options are all specific to where you live. And so this is available on our website. It changes frequently because the laws are changing frequently, and we're certainly in a moment in time where things are changing even faster. And so this is where we're putting information. And then we also have educational materials on a variety of topics, including many related to finances on our website. And I brought you just a couple examples of what those handouts look like. And then we also have an educational blog, which is where we share information on substantive topics, events going on in the cancer community, our partner organizations in the cancer community like YSC. But we're also putting out that late-breaking news, things that are changing related to healthcare and employment and some of the other medical marijuana, some of the other laws that are going on. That's what's on our blog and our monthly newsletter as well. So there is this new term called financial toxicity. And it was actually coined by some researchers from Duke not that long ago in 2013. But as I mentioned, I've been doing this a long time, and financial toxicity might be a new term, but it's certainly not a new problem. The cost of cancer care has been high. It's certainly gone up. Our medical expenses as a country have gone up as a whole, and the cost of care has risen, but it's certainly not a new problem for patients to figure out how to actually manage their finances after a serious medical condition. So when we're talking about financial toxicity, there's so many things that go into your finances, right? Whether or not you're able to work, do you have access to disability insurance if you need to take time off of work? Do you have health insurance coverage? Is it good coverage? Does it actually cover your providers and your prescription drugs? Is your insurance company denying everything? And so you're having to pay out of pocket for your medical care. And then there are life changes too. Are you getting married? Are you moving? Are you graduating from school? Are you retiring? All of those things have an impact on our finances. So when we start to look at how can we improve our financial health, you have to first start with getting a sense of where you're at. So you first have to look at where your finances actually are. And sometimes that's the hardest thing to do, because to actually really look at everything and to look at that big picture can kind of be scary and depressing, right? When you actually see the magnitude of maybe how much debt you might have, or your student loans and your mortgage and all of those things together, you really just want to put your head in the sand and pretend that you can just focus on, do I have enough money in the bank account to pay the bill that's coming in next? And if you want to get past that moment, if you ever really want to be able to take the next step past that, you have to look at the big picture, as painful as it might be in that moment. And so we have a tool on our website. So we have financial resources on our website at this link on the slide. And it's an Excel spreadsheet. So we created it and left it there for you to be able to use and manipulate for yourself. But it helps you try to figure out where are all the places that you have income and what your assets are. So do you have a life insurance policy, or do you have a retirement plan? Do you have a savings account? So to start to actually create a list of what all those are, and I know it's hard to read because I've cut it up for you, but on the right-hand side, you can actually put your account number in and what the value of that savings account is and the login information. So you can really start to get organized and keep track of everything in one place. And that's just helpful in general. So I was just talking right now about having to change your name when you get married. If you decide to do that, and it's actually a real pain to have to change your name when you get married because you have no idea how many things your name is on. And so even just having this list of everything that all of your accounts is helpful in that moment. So it's a good idea just to get organized. So this is there for you, but then you also have to look at all your expenses. So what's your mortgage or your rent? Do you have credit card bills or student loans or any of those other accounts as well? So you're gonna look at your income and then your expense. And just see where you're at. And then you have to think about, if I'm gonna take the next step and get past this moment, what does my financial situation look like right now, but also what is it gonna look like in the next few months or even a year? So if I've had to take time off work, how am I gonna get back to work? Do I have a steady source of income? Am I on disability benefits? Do I get alimony payments? Any of those things, you need to sort of start to gather that information and think about not just where you're at this moment, but over the next few months and maybe into a year, how that might change over time. And then you actually have to create a budget, which is different than that first spreadsheet, because that first spreadsheet is really just listing all your accounts and where your income and your assets and your expenses might be. But then to move past that, you have to actually see what you're spending each month and then plan around that. So the only way we can actually save money or change our financial picture is to figure out how to cut back on expenses and maximize our income. And so this is just a list of where, even the hidden expenses, like, do you have a Netflix account that you don't even really think about? So like those little things that actually can add up every month. But actually really finding every single place where you're spending money, and is there a way to change that? And so even things like if you have cable television, where you might also have internet or phone service, sometimes you can actually call them and say, what's your latest deal? What promotion do you have going on? Can I change my plan? And they might be able to cut your bill in half. But if you're not asking those questions or kind of looking at that big picture and seeing where you might be able to make some of those changes, then you're not going to be able to do that. So it never hurts to ask, because then the worst thing that they can do is say no. Or even play companies off of each other. So you can say to DirecTV, well, Time Warner is offering me this. What can you offer me instead? And you'd be really surprised at what they would be able to come up with. And then there's a lot of different templates to create a budget. You can actually start with that spreadsheet too and sort of customize it as well, but it's easy to find budget templates online now. But then you also need to look at your credit score. So how many of you actually know your credit score? Oh, I'm so impressed. Very, very impressed. So really your credit score actually controls your whole life, basically. So your ability to get an apartment or a loan or a credit card or even that cable TV account all depends on your credit score. And it's so easy to have a negative credit score when you're dealing with mounting medical bills and all of the other financial impact that comes along with a cancer diagnosis. And so the first thing you really should do is actually check your credit score. And not just because you think you might be buying a car or applying for that cable bill, but also because it's going to have an impact on your finances moving forward, and it's still a human process. So there could be mistakes on your credit report, and we see a lot of identity theft still, and we also see confusion. So if you have a common name, it is not uncommon for somebody else's bad debt to end up on your credit report. So you do actually want to pull your credit report at least once a year and just check it to make sure nothing surprising shows up on your credit report and make sure it's accurate. And I've included the 3 credit reporting agencies, Equifax, Experian, and TransUnion. And you want to make sure that you see the information from all 3 of those because they're all different. So different things might show up on different companies' credit reports. And just make sure the information is at least accurate. And then if it's not, they all have a process on how to dispute what's on your credit report. And then if you're in a situation where your credit score has taken a hit, how do you actually change that credit score over time? So the most important thing is to make sure you're at least paying the minimum payment on whatever car, loan, rent, mortgage that you have, so that you're not getting dinged for that. And the greatest percentage of paying your bills on time is what goes into your credit score. You also want to be really wary of paying your medical bills by credit card. And I'm going to get to medical bills in just a minute, but then once you put your medical bills on a credit card, you're changing the type of medical debt. So most of the time, hospitals are not reporting the money that you owe them or your providers to a credit reporting agency. So those medical bills are not actually impacting your credit score. But the second you put them on a credit card, they are impacting your credit score. And so you might have to pay by credit card, and you might not have another choice, but you should think about doing that and what other options might be available before you do. The other thing you want to be careful of is actually changing your unsecured debt to secured debt. So unsecured debt is a credit card. So it's that debt is not being secured by any property. But if you have a car loan, that actual car is securing your loan. So if you ever stop being able to pay your car payment, they're going to take the car back. And so it's securing the debt. Same thing with your home. Your mortgage, if you stop paying your mortgage, it's secured by your actual home. So if you stop paying your mortgage, they're going to take back your home. So a lot of people think, well, I'll take out a second mortgage on my home so I can pay my medical debt, and they've changed that medical bill from unsecured debt into secured debt. And if they stop being able to pay that second mortgage, then they could potentially lose their home. So there's some thought that needs to go into it before you start to make these decisions about how you're going to pay some of these bills. Now the good news is that your bad debt and even a bankruptcy doesn't stay on your credit report forever. So generally speaking, only bad things stay on your credit report 7 years, and then eventually they will fall off. So there's some thought to go into that too. So if you have a past bankruptcy on your credit report, but you're looking at buying a home or getting a car or even applying for an apartment lease, you might wait if you know next month that bad debt is going to fall off your credit report to actually apply for those things, because it will greatly change your ability to get a good interest rate or what you might pay for that car, or that house, or that apartment even. So it's good to know also the timing of when things will fall off your credit report to affect your credit score. Now, I know this is a lot of information, and there are places where you can actually get help to start to figure this out for you personally. The National Foundation for Credit Counseling is a national nonprofit organization. It's really like a membership association of all the credit counseling agencies across the country. You want to make sure you're going to a reputable credit reporting agency. There's lots of things that you see on television that are not necessarily reputable. And they can actually help you figure out your budget and figure out how to reduce your debt and negotiate with creditors. But you want to make sure sometimes that you're not negatively impacting your credit score. So I get a ton of junk mail. So every day I think I get something in the mail that says, we'll give you this loan to consolidate your credit or your debt. And that sounds really appealing, except that consolidation of debt might impact your credit score, because what they're doing is they're actually telling your creditors that you can't pay, but they're negotiating a lower payment plan, which sometimes is legitimate and isn't going to impact your credit score, and sometimes isn't. or is. And so you want to actually ask those questions about, if I'm negotiating these payoffs of my creditors, how is it going to impact my credit score? Now, I think I'm not going to spend a ton of time talking about health insurance, but I do want to talk about two specific things. One, how do you minimize your out-of-pocket medical expenses? And then two, how do you deal with your medical bills once you have them? And so I think the most important thing that is getting missed right now, especially in all this conversation about changes to our healthcare system, is that no one understands our healthcare system. And I feel like I've been doing this long enough to say that. I think that applies to the healthcare professionals that I train, the patient populations. I think really no one has a complete understanding of every aspect of our healthcare system, which makes it really difficult to actually navigate the healthcare system. And so I want to talk about some terms that you should know about your health insurance coverage, regardless of what type of health insurance coverage you might have. So when you get your health insurance, when you pay for it, or when your employer pays for it, they're paying a monthly premium. So that's what you pay each month just to have the health insurance. If you never got medical care during the year, you would still have to pay your monthly premium. But then there's medical expenses that you pay when you actually use your health insurance coverage to get medical care. And so first you pay your annual deductible. It's what you pay out of pocket first before your health insurance coverage even kicks in. So you might have a $500 deductible, or you might have a $5,000 deductible, depending on the type of health insurance coverage that you have. Then there's something called a copayment, and that's also a fixed dollar amount that you pay when you get certain types of medical care. So you might have a $20 copayment to see your doctor, or you might have a $40 copayment to see a specialist, or a $250 copayment to go to the emergency room. And that's different than a coinsurance or cost share amount. And those are terms that are used the same way. But it's the difference between what the insurance company pays for your medical expenses and what you pay for your medical expenses. So if your plan is an 80-20 cost share, the insurance is going to pay 80% and you're still responsible for 20%. So Medicare would actually be an example of an 80-20 plan. And then that's different also from an out-of-pocket maximum. And that's probably the most important thing that you should know about your health insurance coverage. Because in a worst-case scenario, it's the most that you're going to pay out of pocket for your medical expenses during the year. So you might have, again, a $2,000 out-of-pocket maximum for the year, or you might have a $20,000 out-of-pocket maximum for the year, depending on the type of coverage that you have. And the way that you reach your out-of-pocket maximum is actually a math problem. So you get to include your deductible, and then you add up any co-payments that you make during the year, and then you add up any coinsurance amounts that you make during the year. And then once you hit that out-of-pocket maximum, the insurance company kicks in at 100% and pays for all of your medical expenses for the rest of the year. And so that's why it's so important that you know what that dollar amount is, because it allows you to plan for that worst case scenario. And frankly, when we're talking about cancer care, you're typically going to hit your out-of-pocket maximum during the year. And so to give you an example of how this actually works, David has just been in a car accident and he spent a week in the hospital and he walks out with a $102,000 hospital bill. But he has a plan that's a $2,000 deductible. It's an 80-20 plan, and it has a $4,000 out-of-pocket maximum. So of that $102,000 hospital bill, assuming he's had no other medical expenses during the year, how much does he actually have to pay? You guys are quick. So this is what it looks like when you actually go through the steps. So first he's actually going to pay his $2,000 deductible, but then he still has $100,000 left of that bill. But the insurance company is going to pick up 80%, and he's still responsible for 20%. So that's still $20,000. But of that $20,000 remaining, how much does he actually have to pay? $2,000. Because then at that point, he'll have hit his $4,000 out-of-pocket maximum, and the insurance is going to pick up the rest. So I'm certainly not suggesting that $4,000 isn't a lot of money, but it's certainly better than the $102,000 hospital bill that he started out with, or even the $20,000 of the 20% that he was responsible for. And so that's why it's so important to know what your out-of-pocket maximum actually is. Now, I'm not going to spend a lot of time talking about the Affordable Care Act, but there were a lot of consumer protections in the ACA that aren't really discussed about in the news at all, or even in the cancer community sometimes, but that have had a huge impact on finances and minimizing the chances that you're going to have to file bankruptcy because of your medical bills, which is frankly one of the goals of the ACA. And so these are just some of the consumer benefits in the Affordable Care Act, and we have a ton of resources on these topics, so if you wanted to learn more, I would definitely point you towards those. But I do want to talk about how to make choices among the health insurance options that you do have available to you so that you can avoid some of those out-of-pocket costs down the road. And one of the ways that you can do that is by comparing your health insurance choices. And so in California specifically, because I know that's where we are at the moment, we have a state-based health insurance marketplace, and there are 12 others around the country. But even regardless of where you live, you can start at healthcare.gov to actually find your health insurance choices. And when you go to healthcare.gov, the first thing that it asks you is it actually kicks you to your state based on what you answer. Is there a question in the back? Oh, that's okay. That's okay. So healthcare.gov sort of rearranges their website on a daily basis, and so I can never find things. It always takes me a long time to find what I was looking for. So if you actually go to this link at the bottom at healthcare.gov/C-plans, you can go directly to the page where it asks you your age, your zip code, your household income, and the number of people in your household, and it will give you your health insurance options based on where you live, in addition to any financial assistance that you might qualify for to help get that health insurance coverage. So even if you feel like you have good coverage and you're set, it is totally worth just going and looking to see what's available to you, because you never know. You might find even that the marketplace plan is better coverage and covers your providers where your employer plan might not. So it's always worth going and looking at your options and comparing your choices. And one of the things that these marketplaces do is give us some of the tools as a consumer that we've never had related to health insurance coverage. So I always say we spend way more time comparing our choices for a pair of jeans or a phone or a car or, how many of you ever bought anything online? Yeah, so it gives us some of those tools that we use in every other aspect of our lives, but not for our health insurance coverage, because we just haven't had that in the past. We didn't have the information to be able to make choices and comparisons well. And so this is actually a slightly old example, but once you actually plug in that information, it gives you all of your health plan choices. And I've put in an imaginary person, and this person has 69 different health insurance plans available to them based on where they live in their marketplace. And you can start to sort the choices. So you can sort the list by the premium amount or by the deductible amount. You can sort the list by saying, I only want to see monthly premiums under $200 a month or $300 a month. I only want to see bronze plans or silver plans or gold plans. I only want to see PPO plans versus HMO plans. I only want to see plans from this health insurance company. So it gives us the ability to start to sort through this information. And then whichever choices you have available to you, whether you're shopping in the marketplace, whether your employer gives you multiple choices to choose from, whether you're on Medicare and are looking at your Medicare options, you always have to do the math and compare the plans. And this is the way that you do the math. So for this person, I've picked the cheapest silver level plan, the cheapest bronze level plan, a silver plan in the middle, and the most expensive platinum level plan, which is the highest level of coverage in the marketplace. And you can see that bronze level plan is $173 a month for their monthly premium, but it has a $6,000 deductible and a $6,000 out-of-pocket maximum, which is almost as high as it can be in the marketplace. Then the silver level plan is another $100 a month, but has a $2,500 deductible and a $5,200 out-of-pocket maximum, which is also still kind of high. But then the platinum level plan is another $120 a month at $398, but has a $0 deductible and an $1,150 out-of-pocket maximum. So just by looking at these options, can you tell how much it's going to cost you by the end of the year? I can't. I actually have to do the math. So the way that you do the math is you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have that plan for the year, and then you add it to the out-of-pocket maximum. Because in a worst-case scenario, if you're going to hit your out-of-pocket maximum, it's the most that you're going to pay out-of-pocket for your medical expenses. So that should be your total healthcare costs for the year. So which ends up being cheapest? The platinum level plan. So by thousands of dollars even. So even though we get sticker shock when we see that monthly premium, if we don't actually do the math, you don't know what it's really going to cost you by the end of the year. And most people are going to want the cost of that health insurance coverage spread out over a year as opposed to hit all at once. Assuming that the silver level plan was the cheapest, why would someone still want the platinum level plan in this example specifically? Yeah, so there's no deductible. So if you want that silver level plan, you're still going to have to pay $2,500 up front before your health insurance coverage even kicks in. That's a lot, but to pay a $2,500 check up front. And so again, someone might pay more over the whole course of the year rather than have to come up with that $2,500 up front. So there's still some other things to look at besides just the end of year cost, and to pick the plan that's best for you and your financial situation. Yes? Great question. So even though the deductible is zero, you're still going to have to pay co-payments during the year, and you're still going to have to pay co-insurance amounts that are going to help you reach that out-of-pocket maximum. So every time you go to the doctor, if you're paying $20, that $20 is going to help you add up to that $11.50, and then at that point, you would hit your out-of-pocket maximum. In the back? I will definitely do that. So that question was, if you have a $0 deductible, how are you ever going to hit that $11.50? When would you actually pay it? And so you're going to get to that $11.50 by the co-payments and the co-insurance amounts. So it's the three of those things, deductible, co-payments, co-insurance, that help you reach that out-of-pocket maximum. So even though you're going to look at cost, that's certainly a primary factor. We're in a session on finances. You still want to actually look to make sure that whichever plan you're looking at actually covers your providers and your prescription drugs. Because if you pick a plan that doesn't cover those things, it's effectively useless. You really want to make sure that you're going to have that coverage for the things you're getting care for. And so otherwise you're going to have to pay out of pocket for those things if your plan doesn't cover it. So you still want to look for those things, and the marketplace gives us a tool to actually do that, that we didn't have before. Before you had to read through like thousands of pages of health insurance company documents to find those answers. Now they're available on the site. So once you click on a health insurance plan on the marketplace, it gives you a link, that tiny arrow down at the bottom, to the provider directory, so you can check for your providers, and then also the list of drugs covered by that plan. Now, insurance companies aren't great about providing the best information to be posted on these sites. So we've seen that in the news. And so I think Aetna a couple weeks ago, in California specifically, like 50% of the providers were wrong on their directory. So that's not really helpful. That's garbage in, garbage out. So if they're providing garbage for the list, it's not really helpful to us as consumers. So you still want to double check with your providers to make sure that they're actually taking those plans. Now be careful when you do that, because if you go to your provider and say, do you take this Obamacare plan? Oftentimes your provider is going to say no, because remember, they don't understand the healthcare system either. So they might actually have a contract with Blue Cross or Blue Shield or Aetna or United Healthcare or any of the health insurance plans to provide that care, but they don't understand what Obamacare is or the Affordable Care Act or the marketplace, so they think that they don't take it, but they actually do. So you want to actually ask for the exact name of the plan. So in this case, the United Healthcare Silver Compass Plus 2000-1, and see if they actually take that plan. Question? Yes. So let me repeat so people can hear. So the first part of the question was, what's the difference between a PPO plan and an HMO plan? So an HMO plan stands for Health Maintenance Organization. So that is what's referred to as managed care. So insurance companies are managing the care that is being provided to you, and in some cases limiting the coverage, but also limiting the providers that you can actually go and see. So they create a network of providers. And if you want to go outside that network of providers, you're going to have to pay out of pocket in most circumstances to get access to those providers. Versus a PPO, which stands for Preferred Provider Organization, which typically has a broader network and more choice. HMOs are often less expensive as their monthly premium, but you're getting less choice. So PPOs are more expensive, but in reality, what you're really paying more for is more choice. There are also hybrids of these plans. So in some of the marketplace plans, you might pick a platinum level plan that is a 90-10 plan, but if you want to go to an out-of-network provider, they'll only pay 50%. But that's actually better than 0%. So you can also look to see where there's hybrids of these options in the marketplace as well. The second point was, if you're going to your doctor's office and asking if they take a particular plan, it's typically most helpful to ask the person who's in charge of billing. So depending on how large your provider is, that might be a whole office or it might be a person. It's typically not as useful to ask the actual physician that you're seeing because they're less likely to know which plans they take. And if you're looking for whole hospital systems, sometimes if you Google on the hospital system page, it will tell you all of the plans that they take, whether it's employer plans, small business plans, marketplace plans. So you can actually search that information straight from their website as well. Now, one of the other areas where we see a great deal of impact on finance when it comes to health insurance coverage is where a health insurance company says, we're just not going to cover that at all. You're going to have to pay for that out of pocket. And it's important that you actually challenge that decision, because we tend to take no for an answer, right? We assume that the person who is telling us that actually knows what they're talking about. But that is not, in fact, always the case. And frankly, the health insurance as well as the disability insurance systems are set up to deny. And so they kind of assume that you're going to take no for an answer, and that's their business model. So you want to challenge that question. And so you want to actually ask them to reconsider their decision, and that's typically done through an internal appeals process through the insurance company. But one of the things that the Affordable Care Act did was say every state now has to have a process for external medical review, where you get to go to an independent panel of medical experts who are going to determine whether or not what you're asking for to be covered is medically necessary for you to receive. And medical necessity is that legal standard. So many states actually already had this process. California, their process actually began in 2000, 2001. Texas was actually the first state to implement this external medical review process, but the ACA made it federal law. And I would say about 55 to 65% of the time across all states, decisions are being overturned. And those decisions are binding on the insurance company. So it is completely worthwhile to ask them to look again and to go through that external medical review process and to engage your healthcare team in the process, because they can provide you with medical information and letters and research and other documentation to bolster your argument that you should actually get coverage. Yes?
So if somebody, like say my doctor wants me to get a PET scan and my insurance says no, if I decide to pay for that PET scan out of my own pocket, does that add to my out-of-pocket total?
No. Most of the time, things that are not covered by your insurance company do not get applied towards your out-of-pocket maximum. There are some minor exceptions to that rule, but generally no. But if that insurance company says no to the PET scan, that's exactly the moment where you, if your healthcare team is recommending it, where you go through the appeals process to actually have them cover it. In the back, the question? Yes, I will definitely talk about that. So then when we're talking about how do you minimize and deal with your medical bills, there's a cartoon on the slide, so if those of you can't read it in the back, it's two people talking, and it says, "My doctor told me to avoid any unnecessary stress, so I didn't open his bill." There are some ways to lower your medical bills before care. It does take some effort on your part because you can actually negotiate prices and ask some questions. So an example, actually my colleague just a couple weeks ago was at her doctor's office and had some blood work done, and the doctor's office sent it out to a lab, and then she got a really high bill for that lab work. And so she asked, well, I normally don't have to pay anything for my lab work. Why did I have to pay for this? And they said, oh, your lab was not in the network. And the doctor's office actually just has a list of labs, and they rotate who they send it out to. So you actually need to be asking, even in those moments, to make sure that every single provider that you're seeing is actually covered by your network, which is a lot of burden on us as consumers, but it will save you so much in the long run. And there is the ability to actually go to independent labs to get coverage for things if you're having a lot of lab work and blood work on a regular basis. There is also the opportunity to actually do some comparison shopping now that we didn't have before. So there are websites that are comparing healthcare facilities, labs, and providers in your geographic area. Even following up, when you're going to follow up appointments with a couple of people on your healthcare team, if you group them together on the same day, if they're in the same office, you can actually minimize your copays. So instead of, if you go to 3 different follow-up appointments over the week, you might have $20 and $20 and $20 as opposed to being able to group them in one visit where you'd only pay $20 once. And that can add up over the course of your care. So you need to talk to your healthcare team about the possibility to be able to do that. And then sometimes where you have options and there are similarities between generic and brand name drugs, you can talk to your healthcare team and ask them, if I'm being prescribed a brand name drug, would a generic be an option for me? Would it work the same for me? But you do want to make sure, because not every brand name drug has an equivalent generic that is going to work the same way. And so you want to have those conversations with your healthcare team. Now, after you've actually gotten care, I'm going to hold on questions for just a minute so I make sure I get through the content, and then we'll come back to questions. Once you've actually gotten medical care, then you start getting all this stuff in the mail from your healthcare providers. So what typically happens is you might get a letter from your insurance company that says, we've got a claim. Your provider sent us a claim, and we're looking at it. And then you might get a letter the next week that says, we're actually processing your claim. And then you might get another letter that says, this is actually your explanation of benefits. So we've now assessed your claim and compared it to your health insurance coverage, and now we're going to explain to you what your benefits are. And we refer to it as an EOB, and it typically says across it somewhere, this is not a bill. You never, ever want to pay your EOB. And then you might actually get a letter from your provider that says, we've sent in the claim, and this is what we're charging you now. Now, the problem with this process is that's a lot of mail, right? So you start getting all these things in the mail, and they don't come in order. So you might get your, we're processing your claim, and then next week we've received your claim. And it's really confusing, because you're like, wait, I thought you were already processing it. You just got it? And so it's a lot of, frankly, sometimes unnecessary communication, but it creates confusion. And you might actually get your bill from your provider before you get your explanation of benefits. Never pay your bill until you get your EOB. And here's why. A few weeks ago, I went to a regular checkup for a doctor's office, and I got a $1,000 bill plus from the provider, and I freaked out. I was like, what did I have when I went to the doctor's office that was $1,000 that I have to pay out of pocket? I pay a lot for my health insurance coverage. This should have been covered. And then I took a breath after I panicked when I saw the amount that I had to pay. And I was like, wait a minute, I haven't gotten an EOB yet. And sure enough, the provider hadn't even gotten communication yet from the insurance company. They just decided they were going to bill it to me. And I just was like, okay, I'm tabling this, and I'm not going to worry about it for a while. And sure enough, a couple weeks later, I got an EOB, and then I got another bill from the provider that was like $20. And I was like, that's more like it. So that creates a lot of panic and confusion, and providers all contribute to this process as well. And so you want to make sure that before you pay anything and before you freak out, that you actually have that EOB and the bill and you compare them to each other and you make sure that they match. If they don't match, you need to have a conversation with your health insurance company and a conversation with your provider and find out why they don't. And every single time you go to the doctor or you have a treatment or you go to the pharmacy, you're going to get that EOB to be able to match up your bills. So this is really, really important because once you've paid that $1,000 to your provider, it's really hard to get it back. So you want to make sure that you're actually doing that work. And if you are finding your medical bills overwhelming, which can be the case, especially if you're getting a lot of treatment or you're in the hospital for a period of time, or if you have surgery, those EOBs can be really long, pages and pages, and those codes can get really confusing. So if you are confused about your bill, you can talk to whoever is at your healthcare provider's office or billing department to ask questions if you don't understand anything. You are entitled to that assistance. And if you want to do some of that research on your own, I've included some tools to actually be able to do that on this slide as well. There are organizations out there that can help you review your bills and make sure that they're accurate, and if anything has been denied, help you through that appeals process. I would say we've given you some examples. They all charge different rates, and frankly, you want to make sure that what they are charging you is worth it in comparison to what they could be saving you. It can be totally worthwhile, and sometimes it doesn't make sense. If your bill is only for $500, but if they're going to charge you $500 to go through your bills, that's not really worthwhile. So you want to make those assessments. And then you also want to be able to keep track of all that paperwork and make sure that if you're having communications with your providers or your healthcare team, you're keeping track of all of that information. So there are some organizational systems that are out there that are specific to the cancer community, but you could certainly create your own filing system to keep track of that. And that's a good thing to actually ask family members and friends to help you with. All the people that are offering you help and assistance, that's a great thing to put them to work doing. Match up this bill with this EOB. And sort it out for you. And then once you actually have those medical bills and have figured out what you are responsible for paying, you can negotiate with your providers. And most people don't realize this. And I actually didn't think this was really true until one time I had to go to the emergency room and then got a multiple $1,000 bill that I was responsible for because I was traveling and it was out of network and it was crazy, and I was in college at the time. And I actually asked, I'm like, well, I'd love to be able to pay this bill, but I cannot pay it all in one lump sum right now in this moment, but I'd love, I want to be able to pay it. And they're like, no problem, here's your payment plan. And it was completely normal business practice for them to set up a payment plan. So it never hurts to ask for that. Some providers will also take lump sum payments. So if you owe $4,000 and you could pay $1,000, some providers will take the $1,000 and write off the rest of the bill because that's money in hand for them, as opposed to setting up a payment plan where they have no idea if you're going to pay every month. So they're willing to work with you on that, but if you don't ask, you're never going to know. And so then I just wanted to share some of the ways to actually find financial assistance and to think about places where you can find money that maybe you hadn't thought of before. And disability insurance is one of them. There are lots of different types of disability insurance options. If you are having to take time off work because of your medical condition, I'm not going to go through these options, but I did bring a handout on the disability insurance options. It's also available on our website if we ran out of them in the back. And then we also have a webinar that we did on disability insurance that is archived on our website. So if you wanted to learn more about it, you could actually go and watch the hour-long webinar. And then there are also some income options for caregivers that have to take time off also. And so especially in California, we have paid leave for caregivers. So that could be very useful. Also through the state Medicaid program, if you or the person that you're caring for actually qualifies for Medicaid, your family members could actually get paid to care for you through the state Medicaid program. And in California, that program is called In-Home Support Services. It's something slightly different in every state. And with budget cuts across states, it's typically one of the first things that gets cut from the Medicaid program, so it gets harder and harder to get access to, but it is theoretically still there and possible. If you go to our state resources page, the state, for your state, you will find the agency that actually handles that program. And then sometimes we forget about what's actually available to us. So if you work for an employer that has supplemental health insurance coverage, like an AFLAC plan, those plans can actually be really beneficial. So you might be paying like $10 a month out of your paycheck, and you've kind of forgotten that this is even something you signed up for like 10 years ago. And it pays you things like $10,000 check if you have surgery, or if you have to travel to treatment, it pays for your hotel and lodging. So going back and looking to see what those benefits look like at your employer that you've completely forgotten about, including disability insurance. Lots of people tell me they don't have a disability insurance policy through their employer, and it turns out on their first day of work they signed something and they threw it in a drawer and they forgot all about it. So it's always worthwhile to go back and look at your employer's benefits. And then to that question or that comment that was shared earlier, you want to track every single dollar that you are spending on your medical and dental care during the year, and that includes not just the medical bills that you're paying, but your mileage to your cancer center, if you have to travel farther to get to treatment, or the lodging, or the parking at your healthcare facilities. So I live in LA. They charge parking for anywhere you go. So that adds up really quickly. And we're not talking about like $3 parking. I was in South Carolina yesterday, and it cost $3 to park at the medical center. In LA, it would have been $33 to park for an hour at the medical center. So that adds up super quickly. But if you are taking deductions on your taxes, it can actually lower what you have to pay for your taxes or increase your tax refund. So it's worth taking a look at. And then if you have a loan or a mortgage or a credit card or a life insurance policy even, those accounts might have something called a disability waiver premium. And what that means is that if you have a disability or a medical condition and it's keeping you from being able to work, they will suspend your payments so that you don't have to pay your mortgage or your credit card payment or your loan amount or your life insurance premium for those months that you're unable to work. And this is something, again, that's in like fine print when you get the actual account, and they don't remind you that it's available. You have to go back and actually look and read the policy to see if it's something that's available. And I actually went and checked my life insurance policy the other day, and sure enough, I have a disability waiver premium on it. So and I didn't even know, like when I purchased the policy, that was something I should be looking for. So it might be available to you. And then you could actually potentially, if you need a larger sum of cash to get access to an emergency, at taking a loan from your retirement plan or from your life insurance policy. Now there are tax implications for both of those things, so you want to make sure that you're talking to someone, a financial planner or an accountant, about how that's going to impact your finances long term. But if you're in an emergency situation, it might be a good way to get access to a larger sum of money. And then you could also potentially sell your life insurance policy if you have one, and that's referred to as a viatical. And if you're desperate and you need access to the cash, it could be totally a worthwhile thing to do, but you should know that most of those companies that are going to buy those life insurance policies from you are going to really kind of take advantage of the situation. And so often they only pay like 30 cents on the dollar of what the value of the policy is. But again, if you need access to the money, it might be something you want to do. So it's worth looking at. Now, when we're talking about education, we hear from so many people, I have these never-ending student loans. How do I stop paying for that, or if I have to stop working? And so I'm not going to go into all the details, but we've included detailed resources on how you can deal with your student loans. And again, for those of you who came in later, there's a sign-in sheet in the back, and I will send you the slides. And then we also have a resource on our website called Navigating Finances After Cancer, which is about 50 pages of financial resources on everything from medical bills to childcare to utility assistance and everything in between. So that's there, as well as a couple of other archived webinars that specifically deal with medical debt. And then we rolled out a couple of months ago, about 6 months ago, with the SAM Fund, a website called cancerfinances.org. And we actually rolled it out specifically for young adults initially, and then we realized we were limiting the ability for people to get access to it because the content is really relevant to everyone. But it was created initially for young adults, and so that website currently has an entire module on health insurance. Disability insurance is supposed to be up in the next week or so, as well as a number of other topics on finances over the next couple of months. But it's kind of like a choose your own adventure. So I just dated myself. So for those of you who are too young to remember, there used to be these books where you could choose your own adventure and get to different endings. They were awesome. But basically, by answering a couple of questions that are specific to you, it tailors the information to you specifically. And so that is what that resource is. And then